At Cardiff and Swansea University, we researched over 30,000 children in Wales to understand what happens over time to children who have help from social services. We looked at how the children did in school aged 16 and emergency hospital admissions. We compared 4 groups of children. 1. Children in care. 2. Children who were living with their families and at risk of harm, so they were on the Child Protection Register. 3. Children who were living with their families and receiving some support from social services, but they were not at risk. And 4. All the rest of the children in Wales. We found that the 3 groups of children who had help from social services were more likely to have emergency treatment in hospital and less likely to get good GCSE results compared to children who didn't have any help from social services. This was partly explained by difficulties earlier in their childhood. For example, family problems, disability and poverty. But even after taking these into account, the children who had help from social services were at greater risk in terms of their health and education. When we compare the different groups of children who have help from social services, those in local authority care on average got higher GCSE grades and were less likely to have emergency hospital treatment than the other groups. The odds of children on the Child Protection Register not obtaining 5 GCSEs at A star to C were over 4 times higher than for children with no social services involvement. The children who were in need but not at risk had on average over twice the odds of not getting these grades compared to children with no social services involvement. Based on this, it is quite clear that those children who get help from social services while living with their families need more support, or different kinds of support, to stay healthy and achieve their potential at school.